Hello everyone and welcome to NACHO 360. We come to you today from rural Northwest Ohio and we're excited to give a presentation on collaborating for success, advancing workforce development across rural county public health departments.
Hello, I am Jamie Gerken. I'm the Health Commissioner at Defiance County Health Department. I've been with the Health Department for 22 years in various different roles. Started out as a public health nurse, went into a health promotion coordinator, and I've been Health Commissioner here for the last 8 years.
Hello, I am Oscar Hernandez. I am the Health Commissioner in Williams County Health Department, and I've been with Williams for about 2 years, but public health, both public and regulatory, as well as corporate for the last 18 years, and have been with Williams again for the last 2 years, but looking forward to this presentation.
Hello, I'm Nathan Hofre, Director of Nursing here at the Williams County Health Department. Been in public health for about 7 years and have been the Director of Nursing here at Williams for going on a year.
And I'm Brian Heil. I've been working in public health for almost 10 years. I've worked in emergency preparedness, environmental health, and I'm currently the Health Promotion Coordinator at the Defiance County Health Department.
Let's begin with today's objectives. We want to introduce Defiance and Williams County Health Departments, share with you the structure and evolution of our staff and leadership development institutes, and show you real-world outcomes, offer you practical strategies that can be scaled to your department, and emphasize how we align these initiatives with workforce impact and accreditation goals.
Williams County Health Department is located in the far northwest corner of Ohio and borders both Indiana and Michigan. We have approximately 26 staff and we have a 9-member board of health. We have been reaccredited by the Public Health Accreditation Board in 2025 and are extremely proud of our progress there. Williams County itself has about 36,000 public people living here in the county, and our landscape is largely rural and agricultural. Some of the big companies that are here in Williams County include Spangler, Bard, and also Chase Brass.
Defiance County sits just south of Williams County, so we're neighboring counties. We have an estimated population of around 38,000 residents. We also are largely rural, with agriculture and manufacturing being our largest industry, so we really match Williams County really well in our demographics. We were originally accredited in 2019 and are seeking reaccreditation as we speak. Our workforce includes 4 different divisions, which include our environmental health, our community health, our administration, and our health promotion division. We have a 5-member board of health, and we consist of 19 full-time staff, 3 part-time, a PRN nurse who helps with immunization clinics, and currently we have 1 intern through our local college here in Defiance.
So there's many at the conference that can probably relate with being in a rural county, and as we mentioned, we are both rural counties, and that means we face distinct challenges. Recruitment can often be hard, and retention is even harder. We sometimes face competition with the private industry, as there's fewer advancement opportunities in local governmental public health, and there's also leadership gaps. Fulfillment and job satisfaction can sometimes be lower as a result of this. So this type of landscape calls for collaboration, creativity, and shared leadership development. In a minute, I'm going to ask Oscar to share a little bit about the differences in working between public and private, and maybe why he has made those career choices and why he's back in public health today. I wanted to highlight a little bit, though, on our partnership with other health departments and how we can work together during public health events. For example, during COVID, some larger counties may have the capacity to do a lot of things on their own, whether it be contact tracing or case investigation. We really relied heavily on our partnerships with local health departments, just determining best practices and ways that we could learn from each other in the time of a crisis. So there's always concerns with public health tracks that prepare emergency professionals for roles. So we're always looking at ways to continue education development for our staff and take advantage of those opportunities. So Oscar, talking a little bit about being rural and looking at maybe limited opportunities for advancement and different things, can you talk a little bit about why you started out in public health and went to the private industry for a bit, and now you're back at a local health department?
Sure. So initially I started at Fulton County Health Department, which on the map you can see is right there by Williams and Defiance, and was able to head out to Defiance County as their Director of Environmental Health. After about 3 years, I got an opportunity to do corporate food safety and quality compliance, and that was a great opportunity to learn more about manufacturing, distribution, what it looks like at the corporate landscape. But at a corporate landscape, you really find that you really do just become a number, and you're able to really look at Williams County as a whole and see that really when you go to a place like this, work doesn't only become just a place that you work, it becomes a place where everyone becomes like family, and being able to see people grow, being able to see people learn is really a great opportunity in itself. And so having that ability to come back to the rural local health department scene was really good for me because one, got to step back, but in my role I still get to learn quite a bit about contracts, MOUs, MOAs, get to collaborate with other health commissioners and directors throughout the state. Definitely have had influence on legislation already in just my short 2 years here with Williams County. But like I said, we have had a lot of leaders take new roles here, and just really kind of blessed to see them grow into who they are today, and excited to see who they will become here in the future too.
So Oscar mentioned that he was at Fulton County and then came to Defiance and went to Williams, and that's a common theme. Nathan what started at Defiance County and now is at Williams County, and Brian also started at Fulton County and now in Defiance County.
That's right, yeah.
So we have a lot of that. That's not uncommon, especially in the rural atmosphere, that advances come up at other health departments and we move from one health department to another. And so we collaborate and work really well, partner really well with the counties all around us, which is really great. But that's why doing this partnership in leadership development and workforce development is so important, because we not only benefit here in our individual counties, but in our region as well, because we are preparing leaders, a pipeline of leaders to be able to advance public health within our little area of the corner of Ohio.
So why workforce development now? Well, the urgency is real. The De Beaumont Foundation called it a retention crisis. FAB standards push for workforce excellence and continuous quality improvement. Post-COVID, public health is being rebuilt, and that includes credentialed, qualified staff like environmental health specialists, health promotion specialists, public health nurses, etc. It's time we invest in systems that support these professionals. So Jamie and Oscar, can you guys take a minute to discuss maybe your county's workforce development plans and how we came together to create LDI and SDI?
Yeah, so I'll go first. So Williams County, Jim Watkins was a previous health commissioner in Williams County, and they had done LDI with Henry County, which is another neighboring county of ours, and just with some changes, they were no longer doing that, and so Jim approached me about potentially doing LDI and partnering to do that, and I said, sure, I think it's great to do any sort of workforce development, especially one that's local and you don't have to spend the extra money on traveling and conference costs, that sort of thing. So we started LDI, and then we'll talk about this a little later, but we decided we really wanted to expand it. LDI is more for leadership staff. We wanted to expand it to everyone, so we started our SDI, which we'll talk about a little later. As far as our workforce development plan, we're in kind of our second to third iteration of our workforce development plan. We really wanted to hone in on not only the core competencies, but those public health skills that you need that De Beaumont has outlined. So we really looked at that and doing a workforce development survey to identify those areas that maybe we could use some improvement on, or more education on workforce development on. So our workforce development plan definitely centers around that, and centers around LDI and SDI, as well as supplementing with other training as well.
Yeah, and looking at Williams, I can speak to our performance measures as well. So we take our workforce development plan and we actualize that with actual action steps And so we ask that our staff attend so many LDI, SDI events based on their position in the health department, and we track those, and that kind of helps determine where we're at in terms of success and how we're taking care of our staff. But like Jamie, we also do some planning as well. For strategic planning, we look at how our staff are feeling about not one, just the culture, but also how they're feeling about how they have training opportunities. Again, some of those other options like health insurance and whatnot. And so we like to hear what their voice is and what they really need from us. And so without them speaking up and having that avenue, we don't know if we'll always be able to capture that just based on what we think. And so their voice is extremely important to us. And so we do use this workforce, and we're really big about retention and keeping staff. And that is, again, one of our key drivers that not only we as leadership really like to help maintain, but also our Board of Health, and then also thinking about our community. When we have staff that stay, our community also knows those staff, and so becomes that familiar face that you can trust. And so looking at public health post-COVID, I think trust and relationship building is extremely important. And I think LDI, SDI is really just one tool that helps us capitalize on that.
Yeah, and I just want to kind of say a little more as far as what Oscar said. I think workforce development really is something that employees are looking for. We did a kind of like Oscar talked about, what are some benefits you would like to see in workforce development? Definitely was one of those things that rose to the top. We recently did a director survey as well and asked what do you want from your director, and one common theme was they wanted their director to be open to sending them to workforce development opportunities. So that is a common theme that we're seeing amongst all of those within our agencies, I think. So I wanted to talk a little bit about how we developed this framework for innovation in LDI and SDI Leadership Development Institute and Staff Development Institute. So we really started and grounded our model in proven framework, specifically Studer Group, in the Hardwiring Excellence book. That's the book that we originally used for Leadership Development Institute. As I kind of talked about earlier, we probably were doing LDI between Defiance and Williams County for a year, I would say, and we ended up finding the Great Employee Handbook. And that's when it really kind of set off light bulbs of, hey, what if we do something for everybody in the health department? And LDI will focus more on that leadership development, and then SDI, or Staff Development Institute, will focus on staff and really trying to hone professional development and what it is working not only within our agency but out in the public as well, because we're so public facing. And so we used the Great Employee Handbook to develop the Staff Development Institute. And then we also integrated the Busy Leadership Handbook, which really is a great combination of combining both the Hardwiring Excellence and the Great Employee Handbook into one book. So all of these books are available for everybody to use. We buy copies for everybody who goes through LDI or SDI, so we have a lot of books on our shelves that people can reference when doing some presentations. And our focus really is leadership, staff development, and empowerment. And there's different ways that we empower everybody, and we'll talk about that through the next slides as we go on. But it is definitely centered in Studer, but we also have brought in other evidence-based tools into LDI and SDI, and also bringing outside speakers in to share their evidence-based frameworks as well.
Yeah, I can talk a little bit about, it's been a while, so I went through Staff Development Institute before COVID, so I have to like pull the cobwebs out and put myself in that time frame. But for me, it was good to come together with other public health professionals, because we're small, everybody's busy in the day-to-day, and so it can just be really great to have a day that's fully dedicated for networking, not only with our neighboring county, but even people at our agency, because we don't get an opportunity to just get to know each other in the day-to-day. So that was good for me in SDI. The other thing was, as Jamie mentioned, just some of the concepts in the books, just opening up communication with your leader, supervisor, director, however you may refer to them. Capitalizing on your strengths. Again, being a small health department, we need everybody, and everybody brings different strengths to the table. So being able to acknowledge that, learn that I may not be the best at some things, but I may be better at or excel in some other areas compared to other staff. And so if we understand each other's strengths, we understand how we can work together, how we can work well together within our divisions, but also as an agency and ultimately in public health in Northwest Ohio. I don't know, Nathan, if you have any thoughts from when you went through SDI.
Yeah, Brian, I agree. You bring up great points about working and collaborating with, not only people within your health department, but again, people from, the neighboring health departments. Because one of the unique and cool things, in my opinion, that we do with this program is from these books, we actually pull some chapters, and we would partner with, usually somebody with a different health department, and we would partner present different chapters of this book to the group. And usually we try to involve some sort, we go over the topic of the book and what that chapter specifically talks about, but also try to integrate some sort of like activity, some sort of work group that we can kind of engage the audience with. And we do it with the mindset that this is a laid back environment, and really it's, for me going through SDI, it was really seemed to be investing in the staff, and that's kind of the key part that I really pulled from. And so we touched on topics like, knowing your why, what's your why, describing leadership versus management, but also kind of knowing, acknowledging that, we all have directors, and how do we learn our directors, learn their why, and it's important to highlight that. And but not only as leadership from a director standpoint, but leadership is there's lateral leadership, there's leading up, and so many different dynamics to leadership, and that's really what we hit on from when we pulled from different concepts from these books.
Yeah, so for LDI SDI, we adopted peer facilitated learning. So sessions are always off-site, and that helps us limit distractions. So everyone is busy and has emails, they have phone calls, they have different projects that they're working on, and we understand that. And when you're at your office, when you're at your desk, even when you're just in a meeting room across the hall, everyone is compelled to really check on those. And so we really feel that off-site locations really help us out and really give our staff a safe place to be. Also looking at open discussion, and so we really want to encourage everyone when we're at our LDI SDI sessions that you are free to bring up your ideas. In fact, we encourage it to speak up, because that's where learning really begins, is having that open conversation. We really want to strive to help everyone understand that their feedback is valuable, and even if it is correct or incorrect, we give them a safe place to learn different models, different types of thinking, and I think that's really helped us out in terms of the workforce we've started to develop here. Also, again, being outside of the office, again, it's more of a low stress environment. So when we go to these, you kind of shed the dress clothes and we're more in street clothes. And so it's really more of a laid back atmosphere, like we mentioned in the last slide. But it really helps us, again, just be at peace with the environment, the learning process. You can kind of kick your feet up just a little bit and just be a little bit more comfortable. And I think doing that has been really helpful. I know, for example, Nathan in this slide was at this event, and I think he can talk a little bit about how much fun he had, again, because we don't just make it all about learning, we also have fun things that we do, and he'll be able to share just a little bit about that.
Yeah, so you can see the picture here. These off-site locations are really great, and we'll talk about this in the next couple slides, but really what we do is try and promote different activities, and what is just so unique is everyone who comes to these sessions bring their own take on activities. I think through each of these sessions, every time, I never had two activities that were the same. Everyone has their own take, and it makes it for a fun, unique learning environment. And then just going back, have the kind of the unique background, and Brian can share with this too, but coming from the background that we went through SDI as staff, and then now being in those leadership and director roles, we are now, in the LDI portion. So we kind of get to learn the best of both worlds here. But really, we've received really great feedback from staff, and just having this low stress, off-site learning environments. And then also, you'll see too that having the capability to bring in outside individuals to help promote this learning too has been a really great addition.
And I'll just hone in a little bit on the peer facilitated learning component. As we talked about in the beginning of the presentation, there's a lot of times limited advancement opportunities, and so that's just so neat that we have Staff Development Institute is providing an opportunity for those. We have leadership qualities among all of our peers and all of our coworkers, and we don't always get to see them shine in those areas. So the peer facilitated learning environment, them stepping up, working together with maybe a neighboring county to put together a presentation and being able to put their own spin on some topics regarding leadership. And we're going to look at our next slide, which is going to talk a little bit more in detail about what these sessions look like. We always start the sessions off with an icebreaker activity. It's really informal. There's a gathering time. We meet off site, so people are just like in your workday, arriving 15 minutes early or 5 minutes late or somewhere in between. But we have coffee, we have snacks, water, just different things to get people networking right off the gate. And then when we really start the session, we'll do an icebreaker activity. One thing we've done that's been popular, to our surprise, was speed dating. So some may find that to be awkward, but it's an opportunity, again, where you just go. The goal is to find somebody that you don't know well, or maybe that you've never even spoke with. As we sometimes do have turnover, you might go to an SDI session 3 months from now and see somebody you've never seen before. So in the speed dating, you just go, we'll have some prompts. We have some cards, some cue cards to sort of initiate conversation, or you can just talk about whatever you'd like, just kind of getting to know those that will be there today. And that takes the edge off a little bit, whether you're the one presenting or providing feedback to a presenter. Having an icebreaker session takes the edge off a little bit as you get to converse and just get to know each other. We've really worked on looking at different themes that we can integrate into these leadership days. We've blended specific topics such as leadership, diversity, equity, inclusion, and program-specific development. It's really neat to work in public health because there are so many things we do in public health that touch the lives of those around us. Even our coworkers don't understand how much that happens. So for a public health nurse to be able to be at SDI and hear a presentation from somebody that's from environmental health, they otherwise may not really understand some of the things that EH are doing that impact themselves, their family, and our community. So we've looked at some of those specific topics. It could be regulation of the food industry and how that impacts our community, or it could be about a specific population in our community, such as the Amish population, which we have both in Defiance and Williams County. Go ahead, Nathan.
Brian, you bring up a really good point too, is we learn from each other in terms of our different departments, but it's even so unique to when you get these different health departments that come together and we learn, the nursing division learns what the other nursing division is doing, and we actually pull some methods, some interventions, and things that we can cater to our health department, and just sharing of those ideas have been really beneficial, and the feedback has been really well received when we have that capability to do so.
I kind of had a few thoughts that came up for me as I was listening to Nathan and Brian talk. Brian talked about the icebreakers and how they can be awkward, and we always embrace it. I always say, okay, this is going to be really awkward, but the nice thing is it's awkward in a safe environment. So I would rather have the awkward, get used to that uncomfortable awkwardness in a safe environment versus when you're going into a meeting with your peer, with maybe politicians or whatever. So we embrace the awkward, and that is a learning experience in and of itself. The 2024 agenda, we really focused on what we found out on our workforce development survey. And so we really catered our topics to those areas that we knew that we maybe had some improvement opportunities for. So that in and of itself was a quality improvement item that we did, and made sure that we catered the agenda to those areas for improvement. The nice thing too about getting to know each other in the icebreaker is that if you come up with not only learning about what other divisions do, but if you're facing something in Defiance County, maybe one of our public health nurses is facing stuff and they know that Williams County maybe dealt with this too, then they're more comfortable to call their peer in Williams County to discuss what did you do to this. So it also creates a partnership to do best practices and feel comfortable doing that.
I guess the last thing I'll add too is this is not, a set in stone like Jamie talked about, like Nathan and I talked about. In public health, we're always wanting to have data informed decision making, and so we're just taking that and we're integrating that into these learning sessions.
So looking at session culture, we really do our best again to make this a safe environment. So one of the things that we really focus on is really trying to help build our staff and ourselves even, but we do that in multiple different ways. And so we understand that culture is everything. Coming from a corporate environment, I can tell you that looking at the corporate structure is very siloed, and so that is one thing that we really try to break down. So where I came from was retail, and so you'd have a manufacturing, you'd have legal, you have HR, you have people doing operations, and a lot of times those people had no idea what the other person was doing. And so when you look at culture and having the ability to break down silos, I think that is a great thing, especially when you have departments that are only 25 to 30 people deep. You really get to understand exactly what they're doing and how that has a lot of links to what you're doing. So again, looking at environmental health, what you're doing in the food industry with temperature checks and sanitizers and whatnot, really kind of coincides with what the nurses are doing if we happen to have a foodborne illness outbreak, right? So for us, again, understanding that and understanding that everybody's equal but has their own specialty has been really helpful for us. And so that's where we're really able to kind of evaluate ourselves. And so we do have a form right here. It's called an observation document. But what we like to do there is we'll capitalize on some of our wins. So we really look at 2 wins and 1 do better. And so if we have one of those staff that are presenting on one of our 10 public health domains, we'll take the time, evaluate how they're doing and what they did really well. And so that could be talking to the staff with open eyes and good body movement, walking around, or they just read off the slides. And thinking about the Staff and Staff Development Institute, that really helps them understand how they need to grow, because when they get to leadership roles or even farther above that, they really need to understand how to talk with people and just be able to have those relationship building moments. And so I think that's been really good for us. Again, we really come in with an open mind, and so we have those session items built off the Studer group, and having an open mind to not only learn about it, but also learn about how to speak to it too has been something that's been really good. And the nice thing too is that everything we're doing is evidence-based, and so what we're doing today is rooted in scientific studies. And so I think knowing that everything we're talking about really does work helps our staff really have a lot of trust and confidence. And looking at what Nathan and Brian have done, I think they've done great things going from staff to leadership, and I think they can talk just a little bit about how some of these evidence-based items have really shown up today.
Yeah, one of the things that we talk about with evidence-based resources and practice that we integrate with this program that Oscar tied in is one that I can remember that we've brought over with just everyone in the health department from these sessions is like looking at people's strengths, finding your strengths. There's been numerous strengths assessments we've done over the years, and one is the Strengths Finder assessment. Jamie will touch on that in a few slides, but that's been one that really we can apply to all of our staff to let us know, okay, where are our strengths and where can we find maybe space in the health department to really apply those strengths, because that really gives us opportunity to put them into roles that will be most successful for those individuals. And you're going to find that what we like to see in public health is a lot of times you're going to see strengths that are going to have that people have that are going to be applicable to a multitude of different roles. And what you'll see is people will find themselves working in different departments or wanting to navigate and get some orientation into those different departments because they have that passion there. So it's been really great to utilize that, but also to kind of go back to that did wells and do betters mindset. Is that's been really great, because not only do we use that for each presentation when somebody presents, but we also use that for the session as a whole. Towards the end, we kind of tie this up, and really it gives each person the voice to really capture what did they appreciate most about the session, and then what were some things that maybe we could have capitalized on. And so it's really interesting when we look at that and just see how this LDI and SDI has evolved over the years. We found early on that when we brought like outside speakers in from outside agencies, that was always something that was very well received. And so through that feedback, we really do pay attention to that and try and build upon that. And that's in my opinion, a very key piece to this is really having that feedback structure in there.
And I'll be a little vulnerable here to share that I went through SDI in 2019 and did the Strengths Finder, and then COVID happened, and I was not having a good time doing what I was doing, not only because it was COVID, but I didn't feel that I was being fed, and I just felt empty at the end of the day with some things that I was doing previously. And that's not to say that that's not good work. It just wasn't fulfilling to me. I was actually looking at do I want to work at a local health department anymore? Again, it was during COVID, so half of that's hard to balance with some of those thoughts. But I wanted more. I wanted more that aligned more with my strengths. And then luckily an opportunity did open here at Defiance, where I was able to move into a director position in the health promotion division. And now looking at my strengths and what I do today, those are very closely aligned. I have connectedness and strategic thinking, and I'm able to exercise those a lot in the things that I do with leading coalitions and being able to help with leadership and some decision making and reviewing policies and program plans and things like that. So it just goes to show that we don't know how a person feels internally unless they tell us about it. But if we provide some opportunities for them to explore that a little bit on their own, the possibilities could really open up for them.
Yeah, and I think, kind of to piggyback off what Brian said, is you see everybody, like as a health commissioner, I've seen Brian as an environmental health specialist, but he wasn't my direct report. So I got to experience things from, not directly supervising him, but at LDI and SDI, because we're all there, I got to see him at SDI. I got to see how he presented, how he interacted, and how his rapport and partnership and collaboration. And so when this position came open, it was me really being able to look at his strengths and identify his strengths, both in his role, but what I've seen in LDI and SDI, and approach and say, Brian, I think this would be a great opportunity for you. And it was a little bit thinking outside the box because it wasn't in the division he was in, but it's been a beautiful change for everyone involved.
Great to share that conversation with you, Jamie. Thanks.
So we wanted to talk a little bit about the curriculum specifically for the Leadership Development Institute. So this was our flagship program that we started for leaders. We really honed in big on communication strategies, and there's a lot that can be wrapped up into those communication strategies, and I think Oscar will talk a little bit about that. But it's not only the framework for Studer of how to communicate and things, but also how you implement that within your health department. So one of the things that is a Studer concept that both Williams County and Defiance County do is rounding. And that's where, as a director, you round preferably on a quarterly basis with all of the individuals who you direct or who you supervise, and talk about what's going on. And there's key questions that you ask, recognizing someone who has done well, if there was anything that could have been explained better, that you didn't feel was communicated well within the agency. We also talk about, help me out, guys, what are some other things we talk about in rounding?
Well, one part's the relational building. So we don't always have time to get to know each other one-on-one. Hey, do you have any vacations planned? Hey, how are the kids doing? Things like that. We are at work every day with each other. And so it's good to be able to relate on some of those things, I think, on a more personal level with our staff.
One of the things is resources needed or things needed. And I know Williams County shared a story when they started rounding that it was something with the bathroom, just something really simple with the bathroom, but didn't come up until they started rounding.
Yeah, I know early on when we started with rounding, it really, we always go back to, it's the small stuff that really makes a difference with employees. And what we found too is, one thing I can think of is, one employee brought up, man, I really like, ice chips or an ice machine, and so that was, and when we shared that idea, it was something that was well received. And so when we implemented that, we had some really great feedback. And so really that rounding is really good at, again, what Brian said, the relationship building, but also capturing what are those little things that might be monumental to staff and building that rapport and just general, looking at staff satisfaction. So it's a very interesting piece, but it's a great way for us to really get to know other departments and really encourage that, breaking down those walls of your departments and trying to get away from being siloed. And so we really encourage staff to really have they had any interactions with staff from other departments that they would like to highlight, so those success stories from there. And so with Williams County, when we see that staff are highlighted, a lot of times we'll go out of our way to write thank you letters or just give a thank you to those staff that's made an impact on others. So that is one of the key pieces of rounding. So Jamie, I think you did a great job of explaining that.
So as far as coaching and feedback, you definitely learn concepts of how to do coaching and feedback through the Studer concept, but just as simple as the observation form is a way to do coaching and feedback. One of the things that is asked of the presenter prior to presenting is, what's something that you would like to improve upon? We are always our own worst critique, and so sometimes it's really interesting to see what happens is they'll say, I say too many times. And you're really cognizant of that in your own head, but then when someone offers feedback, they'll be like, no, you didn't really say any ums, or you did, but it wasn't distracting at all. So that can help maybe alleviate some of the stress, but also if there is something that, that one improvement, then you can give that feedback and get some coaching on maybe how to improve that a little bit. As far as metrics and data use, we talk in Studer about concepts of performance management, so it does integrate that sort of information within the Studer concepts, but we also use metrics and data use as far as just evaluating how the program is going. So we do the 2 did wells and 1 do better after each session, so we can get feedback and data as far as how the sessions are going. But certainly after a year of LDI, SDI, we also do a survey to see what worked well, what can be do better. And that's where the quote at the bottom bullet came from regarding LDI. Someone said, take this phenomenal collaborative training partnership, invest time in it. You won't be disappointed with what you learn from it. And those are the feedback that we get back in those end of the year surveys. It's really great, and then we can use that data to improve upon the next year. And partnership and team building is just something that we talked about that we do not only by bringing 2 health departments together to do this, but also in the ice breaking within team presenting between the 2 different health departments. So there's a lot of partnership and team building that goes with it.
Yeah, and just looking at Williams from a communication strategies perspective, one thing that we really learn from our staff is that they really like to know what's going on. And what we do is we do a Thursday newsletter. And so highlighting what we've learned from our staff with our survey, we take current events and we list those and what's going on. And so we'll include current events from each division. And really what I do is I pull those events from my director's calendars and really kind of highlight those. So staff really know what's going on, and again, it could be here in Williams County, or it could find staff in Columbus doing training with our youth-led coalition, with our partnerships with the drug-free communities. But we also like to highlight different things like the different House and Senate bills that are going on in Ohio and how that could potentially impact their programs. And then if we find relevant information, we'll link that. And they have that opportunity to take that time to read those and really kind of understand not just what's going on at maybe a staff level, but even what's going on beyond my level at the state and federal level, so that way they can understand how what's going on in Washington impacts what they're doing today. And so that's part of that piece right there in terms of legislation. But we also will highlight great wins. And so taping this, we are actually losing a 40-year staff person who had spent so much time with us. but we'll be highlighting her in her retirement party. And so just being able to do those sort of little things, that generational impact that she's been able to have in the community, just you can't say enough with words, but I hope we do capture that and that staff get to see that we really do appreciate them with how we like to share our information on Thursdays.
Our Leadership Development Institute happens quarterly. Off-site, leaders engage with content from Studer's materials, realigning on vision and communication. The goals are to boost confidence, streamline operations, and strengthen team leadership.
So SDI stands for Staff Development Institute, and we originally launched that again in 2018 as a way to scale LDI concepts to all staff. It's also quarterly, and we rotate that between locations. Again, those locations are between Defiance and Williams County, but we hold them off-site, not at the health departments. We also make sure that we rotate staff. We want to allow all staff to be able to participate in this. Sometimes it might be a gentle nudge if there's a staff member that hasn't participated in several rounds. Then we may, the director or someone may talk to them one-on-one and say, hey, have you considered doing another round of Staff Development Institute? It might be a good idea to consider that. Does it align with your individual development plan? Do you have the capacity to attend these once each quarter, etc.? The focus on these, often we're looking at equity, empowerment, and accountability, giving all employees access to developing themselves as staff members so that they can contribute back into their agency.
Yeah, and I just want to touch on the rotating participation. And one of the unique things is if you're a smaller health department like we are, and if you do this for long enough, you do get to a point where a lot of your staff has been through their rotation, and so that's when we do like to take the opportunity to open up to those who want to continue to volunteer to go, because every year it seems like, and even every session we find just different things that are opportunities for learning engagement, and so we like to be able to continue to offer that. But then also for these SDI sessions, and me personally, without the reason for not having that leadership present is it really helps promote that engagement of your staff and really helps them to share their feedback and have an open and honest discussion. They don't have to worry about any directors or their immediate bosses essentially being there. So it really does again help for that engaging conversations that occur during those sessions. So here's the key message. Empowerment leads to ownership, and ownership leads to engagement.
Something we've started just in the last couple of years is holding semi-annual joint sessions, that is LDI and SDI participants together. These sessions provide an opportunity for staff to collaborate across departments and also unify behind shared goals that maybe they have within the divisions or from agency to agency. Everyone checks their titles at the door, and these moments allow for alignment and can really be transformative. It gives more opportunity for staff within divisions to get to know other leadership at their agency. And I would say for me, this was huge. I wasn't a part of it as SDI, but rather as leadership. What that allowed for me was to get to know some of the other staff in the other divisions, not just the staff that are direct reports to me, but maybe people that I don't have an opportunity to speak with. We've got our WIC clinic, which is physically in the same building of us, but are across the hall. And so by nature of our location, I just don't get to see them that often. So getting to see them more, same thing now that I'm not in environmental, I kind of miss getting to know what's going on in the environmental health division. And so these combined sessions provide some opportunity for that.
Yeah, I think one of the big parts is, kind of leaving that hierarchy at the door. When you go to these sessions, it is, staff as a whole along with leadership, and so you're kind of all on the same level, and you're learning these concepts together as a team, and that has really importance behind it. But it also allows for us to learn more about each other, and so for staff to learn more about their directors, and directors more about their staff, and so it really is just a unique concept that's been really well received.
Yeah, and one more thing to add too, as a commissioner leader, really being able to see staff share their different ideas has really kind of illuminated who they are and their abilities that maybe you just didn't know. And so I think that really helps maybe put a spotlight on them too as maybe a potential leader in the future. And I think that's been something that's really been illuminating to me as somebody who's always looking to see who can help step up in the future.
Yeah, I think the last thing I would share is it is a really safe and laid back environment. So sometimes that in and of itself, combining that LDI and SDI, you get to see leaders in a safe, relaxing environment and maybe see a different side of them, which is great. So one of the great things about this model is it's effective, but it's also strategic. It supports FAB both in domain 8 and 9 as far as workforce and quality improvement. I think I mentioned quality improvement multiple times in the slides before of the way that this enhances quality improvement. This definitely matters during accreditation, ensures that we're meeting those national expectations, and we can use that as part of our FAB standards and meeting those benchmarks.
Yeah, so learning from our implementation, so what we found is that leadership buy-in is just non-negotiable. And so really it starts from the top down, and if we don't have that leadership buy-in, we just don't have a good program. And so also understanding that off-site immersion is just paramount in being able to have, again, that safe environment, but that environment free of distraction. I think you really get to learn some of these key concepts that we're really focusing on, whether, again, it's DEI or relating back to the standards or what we're doing in Studer Group, has really helped us out. And again, both Williams and Defiance have really tied this back not only to our strategic plan, but performance measures and looking at our workforce development plan has really helped us keep our staff, and the staff that we have kept are definitely well trained and understanding of the key concepts we want public health to be. And so the nice thing too is, again, whenever we are going through LDI, SDI, we understand that we can pivot whenever we need to. And so public health is ever changing in our landscape, and we know that. And so that gives us the great opportunity to really kind of focus on what's going on with public health today. And so, 4 or 5 years ago, it was COVID, and today it's funding. And so looking at us too from a rural landscape, we always have that opportunity of finding people who want to work here in this sort of area. So being nestled between Fort Wayne, Detroit, Toledo, a lot of people like to work in those cities, and we want to show that rural public health is important and that you can learn great stuff here. And so having those opportunities to also become a leader really helps us out in terms of resource pooling. And so I think we've seen a lot of leaders come from within, and I think that also promotes another reason why you want to work here at either Williams or Defiance County.
So when we look at cross-sector collaboration opportunities, this model really creates space for new partnerships. So typically we invite academia to support pipeline development, government partners to align funding, and industries to support training and analytics. So it's really, this is your call to connect, because as you as a health department, you're going to be aware of resources and different ideas in your each individual counties. But for us, I think one of my favorite presentations so far actually did come from academia, and specifically Case Western University, which you can see in the picture there. This really touched on, interdisciplinary teams, communication among those teams, and really got into the weeds of just how do we have difficult conversations with employees, and not only that, but it's applicable to communicating with the public in general, right? And so we know, to be honest, public health from COVID-19, as we're rebuilding and trying to build back that trust, it's really navigating some of those difficult conversations and how do we handle those professionally and doing so, really, I guess in a manner that it's always going to be uncomfortable, but really one of the key points was getting comfortable with the uncomfortable. And the more that we do that, the better equipped we are going to be to handle those uncomfortable and awkward, situations. And really, from each of our strategic planning and what we see with staff surveys, communication continues to be one of the top things that we always are focusing on and that staff really want to improve upon. So we've really found this presentation to be well received, and so it's bringing in outside support like that really helps kind of improve that satisfaction for staff here.
A couple other examples too. We had a presentation from a professor at the University of Toledo when we look at subjects regarding government, potential policy or funding opportunities. And that was regarding, although we live in a rural area and everyone has different opinions, is that what we can connect on is our values. So maybe a legislator or an elected official or something, you're trying to connect with them and share all the great stories that you're doing at your agency. One thing that you can connect with them on is your community and those values. We also had a presentation from a staff member at Bowling Green State University, and they were able to do a presentation and teach us about system design and design thinking. So looking at that relates to our industry and the way things are set up. So in public health, if we're trying to make a big impact, we might have to look at some of those things that exist in our communities. So how is the community around us? What type of change can we work on with our community members or leaders or champions to improve some of the health outcomes in our communities? So like Nathan said, it's up to everyone to point out what partnerships exist, but my recommendation would be just to collaborate on existing partnerships. All of those presentations that we had, those occurred because somebody knew somebody and they were able to reach out and say, hey, we're thinking about doing this. Can you come to our neck of the woods and provide this training for our staff?
And one thing that's been really awesome too is when we have some of these outside agencies come in, each individual health departments have actually taken it one step further and bringing them back to their prospective health departments to be able to introduce to all staff to be able to take advantage of that. So it kind of goes outside of the walls of LDI and SDI, being able to pull those resources into your prospective health department.
So we'd like you just to take about 30 seconds and think about some of the stuff we shared and what part of this model could you take and replicate within your organization. Think of how you might adapt LDI or SDI or even just our session structure into your department. So we wanted to take a couple minutes to share within each of our counties what we have seen since we've implemented LDI and SDI. So one of the things is professional development, as I talked about earlier. That is definitely something that we're hearing a lot, that everybody wants as part of their job, is to be able and have the opportunity to continue their professional development. This offers a way to do that here locally, so you don't have the time away from home, finding that time, but also helps to do it in a more efficient way as far as funding. One of the other things we've really taken and ran with in Defiance County is the Strengths Finder, which we talked about earlier. Everybody who comes to the health department does the Strengths Finder assessment, and then we have an Excel sheet with everybody's strengths. So we can use that not only as a tool to understand each other and where everybody is coming from, but it also gives us a way to identify who might be the best suited to take on different tasks or different projects based off of their strengths, because we want to make sure that we're using their strengths and catering to the strengths, because that naturally is going to allow them to enjoy their job better. We've definitely seen some enhanced communication opportunities, both through rounding, but also just getting to know each other better at the LDI and SDI, but also across county health departments, and being able to communicate more openly because we know each other better. Presentation practice and public speaking, I think, is one of the key things. There was a comment, if you present, don't stress so much about making it professional. I learned more and enjoyed the presentations that were relaxed but relatable to me. So I think we found so many individuals who come in and are so scared to present because they haven't had to do that before. But it's really beautiful to see them grow in public speaking, and also see them become more confident in public speaking. And that only benefits us as an agency. Mutual learning was something that we did with Case Western, and really understand the neuroscience behind team development and how we operate and interact as a human being. And that's been really powerful to explore more within our agency and really has provided another layer of understanding each other and ways to communicate more effectively. Leadership development is definitely something that has been expanded upon both directly and indirectly. As we mentioned previously in the presentation, there aren't a lot of advancement opportunities in rural health departments, so you need to create other ways to create leadership opportunities, and LDI and SDI is definitely one of those. And you can not only have avenues to be a leader, but also hone those leadership skills, which then in turn can lead to internal promotions. So any of our directors we have here currently have been through internal promotions, and so we definitely see the benefit of LDI, SDI from that standpoint. And then lastly is staff retention. We've had a really good we've done really well with staff retention, and I think that LDI and SDI definitely has been part of that because of all of the things that we have already discussed and that I highlighted on this slide. So Brian, I don't know if you have anything else that you wanted to highlight.
Yeah, I'll just add, taking that and then applying it back in the workplace. So when we created our new strategic plan, which we're operating under now in 2023, we looked at, well, how can we provide more of those leadership opportunities? And so we asked for prospective team leads. So our strategic plan is a balanced scorecard, and we have 4 different areas that we focus on. And so we asked for leads for those, and the leads could not be director staff or leadership staff. And we did have people step up to the plate and take that on. And it gives them opportunity in the day-to-day, but also in the long-term goals of the agency to have some of those leadership skills that we know that exist, and for them to be able to exercise that, facilitating meetings, tracking progress of the groups, reporting progress out to the health commissioner, who then reports it out to our Board of Health. So it really is a very important role that they're able to utilize.
I think some great points that both of you made, kind of going back to looking at some of those skills that you build upon. But for me, it's one of the things that I feel like I learned from was the whole presentation practice in public speaking. I had the opportunity to go through this course several years ago in SDI, and I will say that was not, in my opinion, one of my strong suits, but really engaging in that and practicing in those skills really made it applicable for me in my current position. And it's really great because now it's, I do have that level of being comfortable speaking in public. With most of us do go to some of our local academia institutions, and we speak like on a public health panel to students and to staff there, and that really hones in on really what we do in public health operates outside of the walls of our health department, right? So we're constantly wanting to get out into the public, and that's really where all of our programs are tailored to. So we really want to make sure that it really is an important piece of this program is those public speaking skills. But another interesting part too was the Strength Finder. When I did this several years ago, I had taken that Strengths Finder and then taken again, I want to say a couple years ago, and it is really interesting that actually my strengths evolved over time and did change. So it is really interesting to see when you have individuals take those a few times that those do change over years when you get into new positions and new roles and you really find yourself kind of evolving in your skills.
So the snapshot of Williams County, definitely adding to what Jamie and Brian said, even along with Nathan, but was very different. So again, I came in 2024 as a brand new health commissioner. And the nice thing about LDI SDI is that we have a course workbook, which we'll talk about in the next slide. And it's a resource you can download and look at with our handouts. But the nice thing about it is that you can come in essentially off the street and really see what the program's about and really just learn about it. And so in my first 2 weeks, Jim was just retiring, Jim Watkins, and I was able to go to a combo LDI SDI session and really kind of just jump right in. And so I think that was really nice. But 2024 was definitely a year of change for Williams County. And so again, being a brand new health commissioner, we had different directors that had opportunities either to advance outside of our health department. And I believe LDI, SDI definitely equipped them with those tools to really move on and do different things. And so, again, Director of Nursing, we lost or saw that Rachel was promoted to a different health department. Now she's a Deputy Health Commissioner, and that's great. We're definitely excited. But in that happening, we were able to promote Nathan Hofer, and I can tell you, I'm just so proud of the things he's done at Williams County with our immunization rates, and even looking at what we're doing with our school readiness clinics and the amount of research we're doing for our parents. Again, I just definitely think that LDI SDI is one of those tools that have really been able to help him out. We had transition Director of Environmental Health. Again, we had Brad Price, who was able to move closer to home and be closer to his direct immediate family, and so definitely happy to see that happen. But Kaylee Holbrook was able to step right in, and some of those things that she was really against was working and not working with the community leaders like our prosecutor. And some of those things that we've really been jumping into is our operation and maintenance program for our sewage treatment systems in Williams County. And Williams County definitely has some of the best water in the country, and trying to protect that with our operation and maintenance program is definitely important. But for her to understand the laws and the way we network is, again, tying that back to LDI, SDI and seeing those concepts in action has been really cool to see her just grow and be able to speak to her program, but speak in a professional manner and just get outside of her box. And then, again, we had Director of Health Education and Preparedness, had an opportunity to do something else, be home with her family, and so we saw Katie Brown step into that role. And so, again, looking at this year, it's been a year of change, but we are jumping into our community health assessment, and so neither her or I had led that before, and just being able to jump right in with a local vendor has been eye-opening to the process. But again, just being able to see her growth and her communication and just the leadership she's taken has been really outstanding. And so this also has been a levy year for us, and so again, understanding the rural landscaping, how funding is so important with those resources tightening up, shows the importance of everybody executing and just managing themselves in a really professional manner. And I think they see that themselves in their daily lives. Nathan talked about in the last slide, but being able to understand that we are a health department without walls and we really go out to our community and serve them where they are has been really important. And again, I think Nathan probably could touch a little bit about how he's been able to jump right into the schools and kind of just be a leader out in the community right off the bat.
Yeah, and definitely appreciate the kind words, Oscar. And I just want to touch, it has been a year of change, but with the entirety of our directors being newer within this past year, but all those have been internal promotions. So kind of going back to that key point of investing in your staff and building those leadership qualities within. So it's really the leadership, the leader in you that I feel like, in my opinion, has allowed me to step right in to the director role and kind of, there is no, nothing really stopping us here, because we really want to take these leadership skills and go out in the community and really engage with them and continue to operate outside of the walls of our health department. And I do attribute much of that, those skills to this program.
So this model works, as I'm sure that you've gathered over our presentation, and it's scalable. We've designed in the last couple years a participant workbook. It has agendas, it has course dates, and it has things to know. What we really wanted was almost a syllabus or something that if someone is going in to do SDI and they've never done it before, we can give them that course workbook, or if we're asking for participants, they can look at that course workbook and have an idea of what it's all about and know what to expect. So we will include that in our resources, but what works here can work anywhere. It definitely can be scalable, it can be customizable, and work for whatever works in your agency and in your jurisdiction.
Here's a few tips if this is something you'd like to try out in your area. Some hopefully key ideas for success. Start off with 3 pilot sessions. Typically a full year would be 4, but you can start out with 3 pilot sessions. Let staff choose development themes through a survey, so give them, this is again that informed decision making. Let them be part of the process and help to create those pilot sessions, and then you can customize the student materials and adapt to your size and structure. So with the Studer books, You can go through those with your leadership team ahead of time, maybe have a couple of meetings, decide what type of materials you'd want to provide to the staff in the form of a survey, and help to create those agendas. So we've done a lot of the heavy lifting in this course book, so you don't have to start from scratch. The one thing you want to make sure of is that you're intentional about scheduling sessions so that you can give staff time to prepare their piece in advance. So this is not only letting them know when the dates will be, but also what's the agenda and who is going to present on those. This is in the course workbook for you to see, but just real high level is that, again, having a different person present each time, and then typically if a person's not presenting, they're providing feedback to those that do present. So just communicate with your staff and leadership so that everybody knows what's going on, and be transparent. Let them know, hey, this is something that is proven to work. We have some counties that have shared their thoughts on this, and we think that it could work for us, and we're open to feedback.
So again, I hope you enjoyed our content, and we really just want this to be more of a call to action. And this is really an opportunity to connect with your team at a different level and really understand exactly what their strengths are and some of their opportunities. But again, I think once you start implementing this program, you will definitely be happy that you did it. Again, modeling our workbook is great, but you can also make it your own. Again, so this resource is yours, and we talk about the Studer group, but there are a lot of great models that you can use as well. And so again, the great idea is that you can make this your own, or even just add to it. And so we'd love for you to be able to do that. And then again, learning to be collaborative, right? And so I think, again, when we're children, we like to do things on our own, but as we get older, we definitely understand the value of networking and collaboration, and being able to reach out to different departments or even different agencies can really help one share the cost of having an outside speaker, but also bring in new ideas and different perspectives you may not have considered. And so again, I can tell you in Ohio, there's a lot of funding that is trying to be more conservative, and looking at that and understanding that it's not just public health that's seeing that crunch, but our engineers and our job and family services and our schools, and understanding how those opportunities for growth and change can be really kind of cross collaborative with different agencies. And just again, partnering is something you definitely won't regret.
So here's some things we really want you to remember. First thing is invest in people. They are your greatest resource. And pair accountability with inspiration. Leadership isn't a title, it's a teachable skill. I just want to take this time to thank you for your time and attention, and hope you had some great takeaways here.
So here's our contact information. We would love to share anything or talk with you about how we did things, so feel free to reach out to any of us at the information provided.